Hey everyone, thank you for coming out here tonight. Really appreciate it. So we're at a very interesting moment in our history right now. Our country over the past 30 years has undergone this massive experiment that's really never been attempted in human history, that we regularly incarcerate. We have behind bars tonight about 1 in every 100 adults in the country. About 1 in every 32 adults in the country is under some form of criminal justice supervision. And the US is completely unique in that we do that. We have a higher incarceration rate than China or Russia or any other country in the world, both in total numbers and per capita. And the main engine driving this mass incarceration of our own people is the war on drugs, this war on an inanimate object, which is really, essentially, it's a war on people, because you can't declare war on an inanimate object. And we're at a very interesting moment, I'd say, in history, because there's opening and an opportunity to significantly shift the way our country addresses drug use. In the 80s and 90s, our prison population exploded. We went from having about 40,000 people in jail for nonviolent drug law violations in 1980 to having about 500,000 people in jail today for nothing more than a nonviolent drug law violation. We arrest more than 1 million people every year just for drug possession, and more than 1.5 million people total for drug law violations. And getting arrested for a drug law violation is a pretty serious thing. Even if you don't go to jail, it shows up on your bank records, your employment history every time you go to apply to school or apply for a job, apply for a loan. And in the 80s and 90s, there was really this hysteria about drugs that really drove that. And the interesting thing is that the past 10 years, that has really changed in a lot of ways. Public opinion has undergone a massive and pretty much historically unprecedented shift over the past few years. In 2006, only 36% of people in the country supported legalizing marijuana. Now that number is about 20 points higher, about 55%. Almost no issue has changed that quickly. And even more broadly, a very substantial majority of the public supports actually, not sending people to jail for drug law violations at all. A recent poll came out from Pew that showed a majority of Republicans, majority of people over 65 think it's a good thing that states around the country are starting to reform their drug sentencing laws so that people aren't sent to jail for as long for nonviolent drug law violations. So we have this massive bipartisan support, and the only thing that's really stopping us is our inertia and our own ability to propose a vision of the future that people can accept. As we know, this is a problem with so many political issues, right? We know what we're doing is nuts. Whether it's the environment or the economy or drug policy, we know it's completely counterproductive. But actually coming up with a vision for the future that people can actually accept and agree upon is a very difficult thing. And I'd say we're at a unique moment in history, but in some ways it's true, in some ways it's not, because every society in history has always had a certain dualism when it comes to drugs. In just about any group of people in the country, they sort of have their assumptions about, well, these are the good drugs and these are the bad drugs. And people who use those drugs, they're, gotta watch out for them. Or people have very real stigma that they associate with certain groups of people. And so even though public opinion has changed in so many ways towards undoing mass incarceration and legalizing marijuana, I think we need to challenge ourselves to dig a little bit deeper to the root causes of how we ended up in this situation. It's not just a matter of that it's racially unjust. Most of the people going to prison don't look like the people in this room. They're young Black and Latino males mostly. And not only is it bad for the economy, that's why states are really reforming the drug laws, because they realize it's a huge waste of money and they just simply can't afford it. But that we need to accept people's choices that they make about what they put into their own bodies, and sort of explore our own fears about that. Like, for example, let me ask a question in the room. According to the government's own data, about how many people would you think who try heroin and methamphetamine get addicted to it? How many people think it is about 75% of people who try those drugs? How many people?
Yeah, I would say that.
Okay, cool. How many people would say it's about 50% of people who ever try heroin and meth end up showing what we would define as a substance use disorder?
Don't be shy.
How many people think it's about 25%? How many people think it's less than 25%? Well, the number, this is according to the federal government's own national survey on drug user health that they've done every year for the past 30 or 40 years. Only about 10 to 15% of people who ever try heroin and methamphetamine become addicted to it. And that's not to say that those drugs can't have very serious problems associated with them, but that is to say that many of the problems associated with them are a result of their criminality and the stigma associated with them. People are not comfortable getting help when they need help. People are forced to take drugs that they don't know the quality of. They're not able to get access to clean needles to make sure that they don't spread AIDS to their family and their community. So, on some levels, we've come a long way, and we're really at an incredible moment when it comes to reducing the role of the criminal justice system and drug policy more generally. I've been working for over a decade now on reforming drug laws. I've worked for the past 5 years for a group called the Drug Policy Alliance. We're the largest group in the country that's working to essentially end the war on drugs and to shift drug policy essentially from the criminal justice system to the health system, and to empower public health and health professionals to make decisions about how we address drug use in our society and how we address problematic drug use as well. And to, as much as possible, reduce the role of criminalization. And so I would encourage everyone to check out drugpolicy.org. That's our website, and we have materials outside. But I'd also encourage you to just try and learn more on your own about what is it about certain drugs maybe that you fear? What is it that that your assumptions are about them? Because I think that'll help all of us explain psychedelics to a wider audience. I think that's the really hard thing. For people who care about psychedelics, we care about it so deeply. It's a deep thing. It's not something you can just explain to someone on an elevator a lot of the time. But we need to find more ways to do that. We need to be able to bridge the divides and to not make, not fall into the assumptions that people have. And because a lot of people have those assumptions about people who use psychedelics as well, that people have about other drugs. I'm sure in most rooms, if you surveyed people about who the average psychedelic drug user is, the sort of myths and misperceptions would be rampant. And you know what's really amazing over the past decade is that the research with psychedelics has really shifted into the mainstream. And groups like MAPS and Hefter and the Beckley Foundation in England and Council on Spiritual Practices have had fantastic success, but they're still working within a paradigm that's really based on the drug war, where a lot of the people making decisions still, a lot of the people that make decisions about what research is able to be done, and even the way, it happens on a certain level of like self-censorship on a level. The research sort of opportunities and outcomes in academia are still very limited by the drug prohibition paradigm. And there's of course, on a practical level, a lot of sort of extra hoops you have to jump through. And there's also a lot of opportunities, I think, in reforming psychedelic drug policies. There's not really anyone talking about that. I mean, I think it's really interesting that MAPS and these groups are working within a medical model to put it through the medical process that we've established in this country and say, does it meet the federal standards for safety and efficacy, and to prove that it works as a medicine. But come on, we all know, like, the medical system, come on. There's a limit to it, and what's defined as medical, it's a blurry area. So I think we need to pursue opportunities as well outside of the medical scientific context, also in the policy context regarding psychedelics. The Drug Policy Alliance is working on a campaign really focusing on, and we're working with MAPS a lot and their Zendo project, focusing on the nightlife harm reduction community and working with event promoters to help them put in place harm reduction policies so that people aren't arrested and people don't end up taking bad drugs at their festivals and at their clubs. So there's a big vacuum right now in between the fields of psychedelics and psychedelic research and drug policy. And I'm really excited to see what happens over the next few years. And I really appreciate all of you being here again. And check out the Drug Policy Alliance if you're interested in learning more, or talk to me. Thank you.